My name is Crystal Grooms, and I work at Family Health Centers for the Opioid Treatment Network. I am a recovery coach and a supported employment specialist. I have been working at Family Health Centers for almost 2 years. The OTN stands for Opioid Treatment Network, and we are a very low barrier program that offers buprenorphine and naloxone, which is otherwise known as Suboxone. We want to make sure that we are connecting with individuals who suffer from opioid use disorders so we can walk side by side next to them on their journey of recovery. Something that we would like everyone to know about our team is that we are loving and compassionate, and we are very grateful to be a part of this program and help people get off of the streets and into recovery and stay in recovery. We really want to make sure that we're connecting them to resources within our community to help keep those individuals that are vulnerable out of harm's way. The OTN also has a contingency management program that offers incentives for our patients who make their appointments or who have passed of UDS or who has made a tremendous amount of effort to make sure that they could be here for their appointments. And we just want to make sure that we're available and that we always keep an open mind and that we're honest and that we can have the lived experience to share with individuals who come through the doors that want to get on our MAP program. Also addresses and supports individuals who have been incarcerated for some time, or maybe they have been sent to us from a referral from DOC. We want to make sure that we keep them connected to services within the community to keep them safe. If we need to make sure that we walk them over to OBHC so they can get inpatient treatment services or outpatient treatment services, we want to make sure that we're connecting them to those resources. Another thing that we like to do is we do a lot of outreach services and Narcan distribution. We want to make sure that we're able to connect with individuals who are at the higher risk of an overdose and distribute Narcan to them to help keep them safe. We do a lot of Narcan training and a lot of other homeless outreach services. Treatment network sees a very diverse group of individuals, and we really want to make sure that we are addressing whole patient care. One of the things that we like to touch on is transportation. Let's say that they don't have transportation. We want to make sure that we're able to connect them to Trango or community transportation, or we want to give them bus vouchers or gas vouchers to make sure that they are able to make it to their appointments. Another thing that we like to address is their housing stability. Let's say that a patient is homeless. We want to make sure that we're able to sit down with them and fill out an application for the housing authority, or at least get them put on a waiting list or find something that is available to them. Another thing that we like to address is to make sure that, do they have food on their table? Do they have children in their home? If they don't have food or if they don't have an income to get resources, we want to make sure that we connect them to the community resources that are out there, such as DSHS, or helping them fill out the application online for food stamps. Or we can definitely give them the connections to go to the food bank. So that way we know that they are able to be taken care of and they have food on their table. Another thing that we like to do is we have an extensive intake process for the OTN, and we really want to address what are their barriers that have a lack in their recovery, so that way we can walk side by side next to them. We want to make sure that we stay in constant communication with the front desk, the care navigators, the RNs, the providers, and the call center. We want to make sure that we're keeping an open communication line so that way we're not missing anybody and we can always make sure that we take care of the needs and the wants of the patients. Because we want to make sure that our providers understand some of the barriers that our MAT patients are going through and really what is the root or background as to why they're in the position that they are. And maybe it's just walking through a family health center doors. Our MAT patients are already full of fear, guilt, and shame. And we want to make sure that we're the ones to help them relieve that stress and to let them know that they're not alone and that we can help support them and help them live a better lifestyle. So when we're talking to our providers, we want to make sure that we have that open communication with them to let them know, you know, what it is that they need as far as support goes and keep that line of communication open.